I'm Dr. Chris Simpson. I'm the Chief of Cardiology at Queen's University and Kingston General Hospital and Hotel Dieu Hospital. And for the past several months I've been the clinical lead for the Southeast LHIN's Clinical Roadmap initiative as it pertains to heart health or cardiac care. Our team, our operational team that is looking at this, is necessarily built from around the region. We have regional representation from lots of different perspectives, different clinical perspectives, and people who are in the administrative and research areas, people who feel these issues on the ground and know exactly how they work from a very practical perspective. And it's really been about taking the things that already exist and are working very well and integrating them together into something that makes a little bit more sense. And our vision very much borrows from the Canadian Heart Health Strategy, which put a lot of time into thinking about how we can make the whole experience or the patient journey better. So for example, right now, if you present to the emergency room with chest pain, that would be a common presentation to the emergency room. It would be quite typical for you not to require admission to hospital, but further investigations need to be done. So we can do all those tests very well right now, but you might have to have a stress test tomorrow in Center A, and then an ultrasound of your heart 2 weeks later in Center B, and then see a cardiologist for follow-up at yet another place at another time. So it becomes each individual component has high quality, and the end point is good, but the journey to get there is very disjointed and complicated for people. It's not very patient-friendly. So it's really about turning the system on its head and building our resources around the patient's journey and what the patient needs, rather than making the patient fit the individual parts. As good as those individual parts are, we just need to make them more around the patient. Most people know a family member or a friend who've had a heart attack, a big heart attack, and it's usually an emergency situation that requires emergency treatment. And in North America in the last 10 years or so, it's become clear that the best treatment is to have the artery opened and stented as quickly as possible. Heart attacks are caused by a blocked artery, and so the treatment is to get the artery open. That's done in specialized centers, and in our center, in our region, that's done at Kingston General Hospital. And so for the past number of years, that's been the way that patients who are very local to Kingston are treated when they come into hospital or are picked up by an ambulance with a heart attack. Whether it's the middle of the night or on Sunday, they come directly to our catheterization lab, which is a procedure where this is done. And the heart attack is aborted immediately. That's led to smaller heart attack size, better outcomes. It's better for everybody. So what we want to do now is to coordinate this better so that we can deliver that state-of-the-art care to a larger proportion of patients in our LHIN. And it's just a simple matter of getting people here faster, recognizing it faster and getting them here faster. So with a partnership with the Emergency Medical Services, we've worked out a plan where we've trained paramedics to recognize this rapidly in the field and bring them to the hospital very quickly so that they can have access to the state-of-the-art treatment. And this will be, I think, probably the most ambitious program of its kind in North America in terms of its reach, offering high-tech emergency care to a largely rural population. The vision is really to conceptualize heart disease as something that needs to be thought about very early on in life, and has different components that need to be engaged right until the end of life. It's very much a continuum. And similarly, there's a continuum from there's a continuum of interventions, all the way from legislative changes that would foster healthy environments, better healthy behaviors, those sorts of things. Everybody knows about the obesity epidemic in younger people, all the way to acute disease management like the heart attack treatment, chronic disease management, how do we keep cholesterol and high blood pressure under control, and then all the way to end-of-life care. So it's about integrating all of this and about understanding how each one affects the other. But again, at the center of the whole thing is the patient who is navigating this journey. And we want to make sure that we can bring the right resources to the patient at the right time. For me, personally, a lot of my views on what is missing and what could be improved on have come from patients and their families, because most of these things are very practical sorts of things that don't necessarily require medical expertise. They require organizational expertise and common sense, for lack of a better term. And given that we recognize that that's really where a lot of the gaps are, I think that some input from patients and their families is really absolutely critical here. Because as much as we've already heard from people, and that's what's helped to build and drive this, we really need to know what people think about this. And to help us to better understand where they perceive the gaps to be and how they can help. So that's why I think we're all on our team very excited about this initiative and about the opportunity to participate in this website and to solicit feedback from everybody who's watching.